Let's talk about nipple shields, those thin silicone covers that sometimes help make breastfeeding more manageable. They can be helpful tools when used correctly, but they're often misunderstood. So let's go over some quick do's and don'ts to help you use them safely and effectively. Do work with a lactation consultant. Nipple shields are not a DIY tool. They're a short-term solution for helping a baby who's struggling with latching or healing up some damaged nipples and should always be used under the guidance of an IBCLC, especially to make sure it fits well and is helping, not hurting. Do have an exit strategy. Some babies love the shield and become a little obsessed with it, which can make weaning from it tough. So always have a plan. Remember, they're not meant for long-term use. Do use it as needed and strategically. If you're using a nipple shield for healing, aim to use it for only a few days and maybe not for every feeding. You can also just use it on one side if that side is damaged and needs a little bit more protection. If the shield is helping with latching difficulties, try at least once a day to latch without it. You never know when your baby's going to figure it out. And a trick some parents find helpful is the bait and switch, which means you start with the shield, then slip it off mid-feed once your baby gets into a coordinated sucking rhythm. And do monitor diaper output and weight gain. Sometimes shields can reduce milk transfer for some babies, so we always want to keep an eye on wet and poopy diapers and your baby's weight gain to make sure that your baby is feeding effectively. Now for the don'ts. Don't use this one without guidance. Shields are sometimes handed out at hospitals without enough instruction. That can sometimes lead to more issues like poor milk supply or slow weight gain for your baby. Don't use a nipple shield to cover up a bigger issue. If you're using a nipple shield because your baby is chompy, can't latch, or has trouble feeding well, definitely book an appointment with a lactation consultant. The root cause might be something like a tongue tie, lip tie, or torticollis, and those need a full assessment. And don't delay getting help. A good IBCLC can help figure out what's going on and refer you to other providers if necessary to help support your baby's feeding journey. And lastly, don't feel like you're failing. Using a nipple shield doesn't make you less of a nursing parent. It's a tool, one that might just be helping you keep breastfeeding going while you and your baby figure things out, and that's amazing. So if you're using a nipple shield or thinking about using it, reach out to an IBCLC for support. It's not cheating, it's not a failure, it's a tool, and we're here to help you to use it the right way.